Hey everybody, my name is Dr. Soren Paape, one of the owners from Smile Now Dental Group. If you've been thinking about dental implants, but you have an autoimmune condition such as lupus, rheumatoid arthritis, Hashimoto's disease, or something similar, you might be wondering, am I even a candidate for dental implants? It's a smart question, and it's one that we hear often. So in this video, I'm going to walk you through how autoimmune conditions affect implant treatment, what we look for when evaluating your case, and why having an autoimmune diagnosis doesn't automatically mean no. So let's break it down. Yes, many people with autoimmune conditions can safely and successfully get dental implants, but we do approach it differently. Autoimmune diseases affect how your body and immune systems function, which can impact healing, inflammation, and how your body responds to surgery. So while it's absolutely possible, it's definitely not a one-size-fits-all. Your treatment needs to be customized based on your health, medications, and how well your condition is managed. We've treated patients with rheumatoid arthritis, lupus, Sjögren's syndrome, Hashimoto's, multiple sclerosis, psoriasis, type 1 diabetes, celiac disease. Each of these presents differently, and we take that into account. In most cases, implants are still a great option as long as we take the right precautions. When you come in for a consultation, here's what we assess: your overall health and immune stability. Are your symptoms well managed? Are you on immunosuppressants? Some medications can affect healing, bleeding, or bone density, such as bisphosphonates. We'll work with your doctor if needed. Bone quality and density is important because autoimmune conditions don't automatically mean poor bone, but it's something that we can check with a 3D scan or special testing. History of delayed healing or infections. Past surgical experience help us predict how your bone may respond to implants. This isn't about ruling you out, it's about building a plan that's safe and successful for you. If you have an autoimmune condition, we may tailor your treatment in a few ways. Stage surgeries instead of all-on-one procedures, pre- and post-op medications to manage inflammation or prevent infection, extra emphasis on hygiene protocols and healing support, collaboration with your physician to align medications and timing, in some cases, additional healing time before final restoration. Our goal is the same as always: long-term success with minimal risk. Dental implants can still be a life-changing option for autoimmune patients, but the timeline may be a little bit longer, and healing may require more patience. That doesn't mean worse outcomes, it just means your body might take a different path to get there. The important part that we walk through with you is that we'll be there every step of the way, and we'll make sure that your needs are taken care of. If you've ever been told you might not be a candidate because of your diagnosis, please don't give up. We've helped patients who were turned away elsewhere simply because their condition wasn't well understood by their provider. At Smile Now, we take the time to understand your full medical picture, not just your teeth, and we'll build a plan that respects it. If you're living with an autoimmune condition and wondering whether dental implants are still on the table, the best first step is a conversation. Make sure to click the link in the description to get your free consultation at one of our Smile Now dental offices. We'll take a full 3D scan, review your history, give you real answers, no pressure. Thank you for watching. Be sure to like, comment, subscribe, and we'll make sure to give real-world answers to your questions. Thanks so much.